As of yesterday, 2nd April 2020, is as follows. The number of confirmed cases stands at 23, with 1 inconclusive. Our deaths as of April 2nd, 2020, remain at 4. The total number of persons who have been tested has moved from 75 to 83, with 23 positives, 59 negatives, and 1 inconclusive.
That was Deputy Chief Medical Officer Dr. Karen Boyle during Friday's live COVID-19 update. According to Boyle, 3 additional persons were added to institutional quarantine, while 1 patient was added to institutional isolation.
The number of persons in institutional quarantine is now 34, while 12 persons are in institutional isolation.
Additionally, the number of persons under home quarantine had increased from 121 on Thursday to 149 by Friday afternoon. The Deputy Chief Medical Officer pointed out some of the challenges being encountered by the ministry in respect to home quarantine.
The persons placed on home quarantine are either refusing to adhere to instructions or recommendations given by the surveillance officers, or are downright refusing to go on quarantine. I am pleading with all of you citizens to be responsible, to take this situation seriously, and to assist us in our efforts to combat the coronavirus disease in Guyana.
Back in March, Public Health Minister Valdo Lawrence announced that a self-quarantine mechanism would no longer be used following several complaints that family members of the first confirmed COVID-19 case were seen intermingling with members of the public.
Now that we have those 4 facilities up and running, and so as of today, any new suspected case, any new persons that would have been in contact or in an area where we suspect that they may have been exposed, there is no more self-quarantine. All quarantine will now be done at the Ministry of Health facilities.
Following complaints from medical practitioners that they were being stigmatized, the ministry says efforts are being made to house the frontline workers directly interfacing with affected patients.
But we are putting measures in place for your protection. The Ministry of Public Health is working with the Ministry of Communities to ensure that transportation is in place for our healthcare workers to and from work. Regarding equipment, the ministry is working to ensure that a stock of PPEs reaches all health facilities. Further, the ministry is looking at provision for housing for those health workers dealing with critical persons so as to reduce the risk of infecting their family members.
Temika Rodney reporting for the HGP Nightly News.